bring her back in. But Jade Lee, let's come to you now. You have recovered from COVID-19. Just with your busy work schedule and having to be amongst people all the time, take us back to when you discovered you had contracted COVID-19.
Well, a very good morning to you, Desiree, and good morning to the viewers back at home. For those that have been following my journey, you would know that I was based in the Eastern Cape, and last year I relocated to KwaZulu-Natal. When I relocated here, it was a week before COVID-19. It was a week before the lockdown, and I was basically just propelled into this life of madness. It's a new province. I'm trying to find my feet as a journalist. I'm trying to find my feet as a person as well. I miss the Eastern Cape. I'm so far away from my family. They're based in Cape Town. But I basically started a new life here. And with that also came COVID-19. My partner is also a journalist, and he contracted the virus. He came home, and that's when I got it. My concern was my daughter. She was starting a new school, what this would mean, and also my colleagues back at the office, because at the time that I contracted COVID-19, there wasn't really a lot of information around it. We were still in uncharted territory. It was new. I was concerned. I wasn't too sure if it was airborne, what the story was, and basically we were stationed at home for 2 weeks. I had to stay at home. It was a very difficult time for me as well because, like I said, it's a new province, and I just didn't know what this virus was, and would my partner pull through, would I pull through, would my daughter get sick? And also worried about my colleagues who I came in contact with, because at the time it was said that you could infect others, and a very difficult time, Desiree. During that period as well, my mom fell sick, and my entire family is based in Cape Town, so it was heartbreaking for me. I couldn't be with her. She was admitted into hospital. Things took a turn for the worst, and it was such a difficult time as a journalist, but also as a human being. Once I recovered and I went back into the field, I was nervous, I was scared, I would come in contact with people. I wasn't sure, if I'd be able to tell the stories of people, because I was touched back at home, but I had to. This is a profession that I have to take seriously, and I went back into the field, and I spoke to people, and I tried to educate them, and I tried to tell their stories. But it was also very difficult going into the field with my colleagues who had also suffered and also lost people along the way. And the next person I'm going to be introducing you is someone that's very dear to my heart. We actually worked in the Eastern Cape together, and now we're both based in KwaZulu-Natal. It's video journalist who has also been, is also a COVID survivor, but also lost a loved one back at home. Nomhle, thank you so much for joining us and for sharing your story. Just take us through your journey as a video journalist in the field, contracting COVID-19 and also losing your mom to the virus.
Thank you, Jade. Thank you, Blaine, for the opportunity to share my story. My mother was diabetic, but her diabetes was mainly under control. She was a big woman as well. She was a little bit overweight. On the 22nd of December, we took her into hospital because we woke up in the morning and we took her to see her doctor, and her vitals were sitting at 35 instead of the 99 that was at least required. When we took her to the emergency at the public hospital in Umtata, her doctor said, I will call ahead so that when you guys get there, they know that you are coming. We got to the emergency, because we came straight from the doctor into the emergency room. We got into the casualty room, and what I saw there, Jade, I still to this day cannot believe that our people still go through such in public hospitals where they're supposed to be taken care of. First, when we got there were no wheelchairs. The wheelchairs, my mom, we had to literally take her inside the casualty room. She could not walk 5 steps without losing her breath. Her chest was tight. She had been coughing the whole night. She got inside. There's a security guard who was sitting at the gate, at the door there. Jade, he was sitting with an empty bottle for a sanitizer. There was no sanitizers at the door. People were moving in and out. And when we got to the casualty ward, there was about 15 people on oxygen there. Some were sitting on wheelchairs, the wheelchairs that are supposed to be wheeling people from cars into the emergency room. People were sitting on wheelchairs. Some were lying on benches. My mom was sitting, we were there 5 to 11. I still remember, 5 to 11 we were there. There were no beds available. So my mother was sitting on an office chair, Jade, an office chair with wheels on it. When she had to go get tested for the COVID, even though we already knew that she had contracted COVID because my dad had previously been tested and his test had came back positive, but he was not showing any signs yet. When we got to the hospital inside, when she had to go and get tested, we had to wheel her in the chair, in the office chair, Jade.
And I just want to come in there, Nomple. This is obviously at a time when hospitals are also trying to grapple with this virus. Take us through the notion, and you were telling me off camera that at the time your mom was tested, even when you were COVID-19 positive and your brother, there was this narrative that, well, just get better at home.
Yes. Jade, one of my most regrets about that time is the fact that even though I was there when the first patient at Hillcrest was discovered, I was there when Dr. Dlomo, Dr. Mkhize, Dr. Karim were trying to navigate us through this new thing that nobody had heard about. I was there in those conferences. I knew the information, but all I was hearing at that time when my mother was sick was 14 days. 14 days this virus is only in your body for 14 days. That's all I could think about. And little did I know, because my brother also fell very ill after my mom had passed. My dad fell ill as well. He was in hospital. When my dad passed, when my mother passed, we couldn't tell my dad. We buried my mother, and my father didn't know about it because the doctor said, don't tell him because his heart might not take it. You must remember, Jade, your system, your body, it works as a system. When your heart is off, your lungs are off, and they are not working in unison, then there's more chance of you contracting a heart attack. So with all of those emotions, we all decided, no, let's not tell him. When my mom passed away, we decided we won't tell him. We'll go. We'll get my father. We'll get my mom buried, and my brother fell very ill at the same time. And the most difficult part when that date is, you must remember, the SABC was going through retrenchments at the time. So while I was at home dealing with my family members being in hospital, I had just lost my mother. My dad was in hospital in a bad situation, in a bad condition. My brother was in hospital. He was worse than my dad was. He couldn't walk 10 steps without breathing. He was crying every time he needed to go to the bathroom. He would cry in anguish. He had no breath. While I'm going through all of that, the managers at work, they're calling me. Nomhle, your retrenchment, there's a retrenchment letter here for you. You must sign this letter. It needs to be back tomorrow. It needs to be back tomorrow. And you must remember, I don't know whether I'm going to go back home when I get back to work. I'm going to have a job when I get back to work. While I'm going through all of that. But I thank God for Umam Linda, because she was a true mother at that time. She called me. She said to me, it's going to be fine. Don't worry about it. It's going to be fine. I went, I signed the papers, and I took them back. But also when I came back now as a journalist, now I'm back at work. I have all of these things that had just happened to me a month. It was basically a month of horror, Jade. A month of horror. I got back to work, and you see all of these people being so blasé about this COVID. Yes. You see people running around with no mask. Yes. You see people in the queues, they're standing. Someone wants to come and stand right on your shoulder when you are filming. We have to go into hospitals, and people just did not care, basically. And you get so paranoid. I don't know how many cans of aerosol that I bought, the sanitizer aerosol that I had bought. Every time I got out to do whatever I did, I would have to spray myself heuristically down. When I got home to my children, I had to leave my children for an entire month. When I left to go take care of my mother, Jade, I left with a bag with two pants and 2 pens. 2 tops and 2 pants, because I thought, I'm only going there, I will be back tomorrow. Little did I know that it was going to turn up to be a month. So for me, as a journalist now, I don't take what we do lightly. I don't take sending out information to people lightly, because I know that had I known, maybe the situation with my mother would have turned differently. Because with my mother passing, at least with my father and my brother, I knew that we cannot wait. We cannot wait. As soon as they start coughing, as soon as they start crying, take them into hospital. And thank God, because at the hospital in Umtata, we did not get any joy. I'm not going to lie to you. They did not have testing kits for diabetic people. The doctor there said to me, we cannot test. She said, people, listen, your government has not bought us testing kits for diabetes, so we cannot test you. She called someone somewhere in the hospital to bring at least one so we could get tested. I mean, it was a horror, but it was a learning experience. I think because my mom died, my dad and my brother could be saved. And the work that we do, I take it very seriously, because without the information that we are giving out, people simply just do not know. All they hear is the social media noise. And from all that social media noise, we need as journalists to come up with a reason, with a voice of reason, so that people learn and people, there's claims of vaccines that the vaccine doesn't work, the vaccine you're gonna get sick or you get electrocuted once you have the vaccine. My dad has been vaccinated, thank you Jesus for that. And my brother, I'm hoping that the time is gonna come when they say all the people that have very ill now must get vaccinated as well. I'm waiting for that. I'm waiting for my chance to get vaccinated, because I simply cannot take that chance. It's my life. I don't want my children to grow up without a mom. I don't want my children to grow up without a mother. So if a vaccination is and the opportunity presents itself, I will absolutely go and get vaccinated.
Nonhle, thank you so much for telling your story and also sharing what you went through during the time that you contracted COVID-19 when you lost your mom, and how difficult it was for you being a journalist in the field. And Desiree, I must make mention of the fact that we're actually coming to you from a vaccination site, Moses Mabhida, where the elderly are still being vaccinated. Behind me tomorrow we will see educators also being vaccinated. And the many stories that the SABC is going to be sharing for the next couple of weeks, talking to journalists in the field, asking them how they went through this period, how they're dealing emotionally, also psychologically, because at the end of the day, and as much as we are journalists, we too are people. We've also lost loved ones back at home. We go out in the field, we tell these difficult stories, and we also try and bring light to the fact that we are living in a pandemic. Wear your mask. I mean, I can't tell you how many times I've gone into the suburbs as well as the townships, and I see people not adhering to wearing their masks, not practicing social distancing. There is, like Nomhle says, also this talk about the vaccines not working, but there is a chance for us to vaccinate. So if you're watching back at home and you've listened to Nomhle's story and you've listened to my story, we're not talking heads. We are only one and two of thousands of people who've lost loved ones who are living this daily. And if you are also needing or wanting any information about the vaccine, do read up on it, but make sure that your mom, your dad, your family is protected as well. Desiree.
Well, thanks to both of you, and these are the human interest stories, the human stories that the SABC is seeking to bring to you under the CoverUp campaign. But let's bring you the promotional work that has been done so far.
Hello Mzansi, my name is Lanele Kupeka. Did you know that there are over 1 million COVID-19 cases reported? Let's reduce the numbers. Cover up. Wear your masks correctly. Cover your mouth and nose. Let's cover up.
Zanele is just so cute, and it's at this point that we bring back in the head of editorial innovation and content development at the SABC and the originator of this project, Dee Yuran. Dee, welcome back. We lost you there for a bit as you were trying to tell us what the campaign hopes to achieve.
Well, remember, I'm just the driver of the process. There's a lot of people that are playing an important role in this whole campaign. And the message is quite simple. Take your mask and cover up. We want everybody to be safe as we head into this third wave. Our journalists are doing a stunning job out in the field. Our reporters come to work every day. Our technical staff come to work every day. And if we can encourage everybody within the SABC to cover up and to do their little bit, and keeping their communities safe, keeping society safe, then we've done a lot in terms of our social responsibility. So on behalf of the SABC News Division, we're appealing to people, please, we know it's been a long time. We know that everybody is a little bit over the whole idea of COVID, but we have to go back to the basics, and a mask will save your life.
Yep. You're putting a lot of emphasis on the non-pharmaceutical preventative measures, but just in the coming weeks, you're hoping to intensify the campaign. What more can we expect, Dee?
Well, as I said, you saw the little clip we had there. We want everybody in society, whether you're a young child going to school, the elderly, even if you've had your vaccine. Remember, there are a lot of people that haven't had the vaccine. So we still need to keep to the basics, and the basics being wear a mask, sanitize, wash your hands, and keep our social distances. So that is what we're going to be trying to promote on our platforms, both digitally, radio and television, as we move into this really difficult period that I think we're going to experience as we see the numbers rising.
Well, a very commendable effort, and we'll be watching to see how it progresses. The head of editorial innovation and content development at the SABC, Deirdre Yuran, and we also have Jadely Paulse and Nomhle coming to us from KZN, just talking about the SABC CoverUp campaign. This as the numbers keep rising, especially in Gauteng. But thank you very much to everyone that took part in this conversation.